Hi, everybody. I'm Mikkael Sekeres, and I'm director of the Leukemia Program at the Cleveland Clinic in Cleveland, Ohio. I'm here today to talk about a book I just wrote called When Blood Breaks Down: Life Lessons from Leukemia with the MIT Press. I was born in the biggest little state in the Union, Rhode Island, and went to college and medical school in Philadelphia before completing my residency and fellowship in hematology oncology in Boston. I'm actually the son of a reporter for the Providence Journal-Bulletin in Rhode Island, and always felt that writing was our family business. From the moment I met my first patient during my training, I've been fascinated with the interaction between that person and his or her healthcare provider, from the moment of that person's diagnosis with a medical condition and the relationship that forms between them over time. I've even based some of my research on the communication that occurs between patient and doctor. Why is this book important, particularly now? We are in unprecedented times right now, facing a disease that we can't control that can lead to a rapid deterioration in health, hospitalization, and even death. The coronavirus has left us all hypervigilant, questioning every action for its balance of risk and benefit, and anxious about the consequences of every decision that we make. What we're facing in this pandemic is not so different from being given a cancer diagnosis, and not just any cancer, one of the worst, leukemia. Leukemia needs a better press agent. I received this advice from my best friend when I told him what specialty I had settled on, soon after I had completed medical school. And in many ways, he was right. Leukemia has a terrible reputation. Before they even get to see me, many of my patients are told that their prognosis is grim and death is imminent. The word is so dreaded that no one in my own family spoke it louder than a whisper, fearing that to do so would somehow invoke the disease. Turns out that was a wasted precaution. 2 family members of mine actually developed leukemia anyway. People are both terrified and fascinated by leukemia in all of its forms. It is a monster, a malignant golem that grows out of control and invades the organs within our own bodies. It is metastatic at its genesis. Multiple times throughout the year, newspapers, television, and popular websites carry stories about possible causes of leukemias. Could it be mouthwash, baby powder? The genetics of these diseases, what we can do to prevent them, and the newest therapies that might just finally cure them. Over the past 3 years, 10 new drugs were approved by the US FDA to treat leukemia, many of which take advantage of leukemia's own machinery to be its undoing. The drama of the moment in which you are told you have leukemia can't be overstated. The world stops spinning. Priorities shift. Your brain can't function. Your rawest emotions, your worst fears are laid bare, and yet somehow you have to regain your footing enough to make decisions about treatment and to define a new normal, if not for yourself, then for your partner and children. Those who go into a remission from leukemia, and who may even be cured, are granted a new lease on life, and often find that they cherish the people and moments they previously took for granted. Those who fight leukemia for months or even years may somehow gather the strength, after all treatments have failed them, to decide that enough is enough and spend their final hours living out what they should have been doing in their final decades. Easily 1/3 of the medical residents who applied to our hematology oncology fellowship program at Cleveland Clinic, in which they trained to be cancer doctors, 300 applicants for 6 positions per year, write an essay about a leukemia patient they cared for. Why? Because there is that moment when a doctor hears about a person whose blood counts are 10 or 20 or even 30 times higher than normal and wonders, am I going to be able to fix this? And then there's the next moment when a person with leukemia meets this doctor who is supposed to solve the awful puzzle of a bone marrow gone horribly wrong. Together they move forward, one step after the other, developing a plan. Their lives become intimately entwined for months on end. As the puzzle pieces are reassembled, the bone marrow functions normally again, and their plan turned out to be the right one. Moments like these are precious in medicine. Heck, they're precious in life. That's what drew me in. When Blood Breaks Down tells the stories of 3 patients who arrive at the hospital, each within a day of the other. 3 people, all told to get their affairs in order when a blood test returned drastically wrong. Joan, a 48-year-old surgical nurse and mother from the rural town of Worcester, Ohio. David, a 68-year-old husband, father, and grandfather. And Sarah, a 36-year-old pregnant mother and wife. One randomly thought 24 hours earlier that she was catching a bad cold. One that he was getting older and slowing down. And one that she was exhausted from morning sickness. And each one made decisions that no person should ever have to make, decisions that affect their lives and the lives of those closest to them. The 3 patients portrayed in this book are actually composites of people I've cared for over the years. The conversations, the medical twists and turns, the aspects of their lives that precede and follow their diagnoses all really occurred. The discoveries that led to the treatment options for Joan, David, and Sarah, as well as the biologic basis of their cancers, are remarkable. A curative therapy that comes from a root discovered in China, experiments in dogs, in beagles, that led to the modern miracle of bone marrow transplantation. The unflagging research efforts of one man on one drug in a rare disease that caused him to lose his job, but eventually led to one of the greatest therapies ever developed for leukemia. Are you kidding me? But they all actually happened. Equally remarkable is the research behind the causes of leukemia, how doctors and patients communicate with each other, and how we all deal with a death that may be imminent. Perhaps most remarkable, though, is their undaunted spirit, their utter humanity in the face of a treasonous bone marrow that has turned on them. The chance to have even a glancing relationship with inspiring people like this, that's what really drew me in. When I'm asked by my friends, colleagues, and patients where they can buy this book, I always direct them to independent bookstores, now more than ever, as we need to support our small businesses. My particular favorite in my home of Shaker Heights, Ohio, is Loganberry Books. Thanks so much for listening today again about When Blood Breaks Down, Life Lessons from Leukemia. I hope everybody stays safe and healthy, particularly in these troubled times.